Bláthnaid Slavin. Perfect, sorry. We have Bláthnaid Slavin, who is a senior speech and language therapist in HSE Primary Care. And we have Katie Green, who's a senior speech and language therapist in HSE Acute Services. So thank you so much, Bláthnaid and Katie, for being here today. We're really looking forward to your talk. If anyone has any questions, if you want to pop them in the chat, we'll do a Q&A session at the end of the talk. So thank you so much.
Thank you so much, Katie, for that, and it's great to be here. So my name is Bláthnaid, and my colleague is Katie, who you can see behind me. We'll switch the camera around when we both start to talk. So we're going to give you a very brief overview of speech and language therapy and stroke. Some of this you will already know, some might be new, and like Katie said, don't hesitate to pop in any questions into the chat, and we'll get to them later. So hopefully now I can get my screen to actually move. It worked fine a minute ago, but the slides are not changing, Katie. So any suggestions?
Sorry, guys. Do you want to unshare and share again, Bláthnaid? Sometimes that helps if it freezes.
Yeah.
You can give that a try, and if not, I can try share it for you.
Yeah, and we can go again, and hopefully. Right, there we go. Perfect. So I suppose the first thing that we'll talk about is your stroke journey, and everyone's stroke journey is different. It generally follows a fairly typical path, but with different stops and different amounts of time along the way. So after your initial stroke, the first few days you're in the acute services. There's a lot of medical professionals around you, and you have your initial bits of therapy and intervention, and then finally you'll progress onto your rehabilitation. You leave the acute hospital, where you'll actually get a lot more intensive therapies from different allied health professionals at that point. You'll plan to move home ideally, which is hopefully where you all are. You shall be discharged, and then you move on to your services at home. And I suppose that's where I would pick you up at that point, because I work out in the community. So you would either come to me in the clinic, or we would meet you in your home, depending as necessary. So I suppose we're just going to talk a little bit about then really about our speech and language therapy and some of the terms then that I don't know if some of you've accessed therapy or not already, or if you're still waiting for it. So these are some of the common terms that you might have heard used, and you might really not be too sure about what they are. So I suppose the first thing then is aphasia. So I don't know if you've heard this. So what we mean by that is it's a language difficulty or disorder, and it's a result of damage to different areas in the brain, the ones that produce and process language. And this can happen after your stroke. So it can cause different types of damage or different types of difficulties. So it can affect your understanding, or it can affect your use of language. And it can affect all different types of it. So your understanding, your talking, your writing, your reading. And I suppose it's just really, really important for everyone to remember, both yourselves if you've had a stroke, or your families, or anyone who is supporting you, that everyone with aphasia is a competent adult who can make their own decisions with the appropriate supports. And having aphasia does not affect your intelligence or your cognition. It is purely a language difficulty, and you can be supported to make your own decisions. So then dysarthria then we talk about is speech. So language is your understanding and talking, and speech then when we talk about is what the words actually sound like. And this results from a weakness of the muscles, and it can make your speech sound, the most common term I suppose you will have heard is slurred. So it doesn't sound 100%, and it might be a little bit hard for people to understand. So that's what they mean when you hear the word dysarthria. Onto that. Then we have something called apraxia. And again, this is something that makes sequencing the movements involved how you talk, and it can make that a bit difficult. So you know exactly what you want to say, but you can't get the words out in the appropriate order. So it might sound a bit funny, or you might get stuck on the one sound with that. And then the other one then that you might hear as well is dysphagia. And then this is talking about difficulties with eating, drinking, or swallowing. And this could be a result of your stroke as well. So I suppose they're kind of the four most common terms you'll hear around stroke and things like that to do with speech and language therapy, and you might know what those words have meant prior to now. So we just said we'd do a quick overview of those common terms. So if you do hear them, you'll be able to know. So then we're going to talk then about communication. So when it comes down to it, communication is the essence of all human interaction and learning. We use it all the time. It's a basic human right, and it's essential to our quality of life as a social species. We're not meant to live alone. We're meant to interact with people constantly. So as human beings, we use communication. So we relate to others. We use it socially. We greet people. We call for attention. We share our feelings. We talk about opinions. We agree, disagree, explain, give information, receive information. We question. We tease. We negotiate. We argue. We curse people out. We comment, protest, complain, describe. There's lots of things we do. We show humor. We tell a joke. We're polite, we make friends, we express interest or disinterest. The range of what we do with our communication is huge, and it boils down to who we really are as a social species. So there's all different types of communication, and up on the screen there is a list of them, of how we use it. So we have our face-to-face, that you will use. You're standing in front of someone, you're looking at them, and you're using everything that's going on, be it your body language, you're talking, you're in the same room to them, you're using that face-to-face. We have our phone. Our radio is a form of communication. You're listening to what other people are saying, they're imparting information. Again, with the television, you're watching and listening at the same time. Then things like social media, so Twitter, Facebook, Instagram, I'm not sure what else there's there, I'm not huge on it. Or again, online dating, again, is another form of communication, which you mightn't actually think of. Texting, email. And then we have our non-verbal communication, and that is huge because it makes up a really large percentage of how we actually communicate our intents and our wants and needs. What we actually say is a very small amount of how we do it, but our non-verbal, so our body contact, our body gestures, our eye contact, how we use our hands, how we look, all of that is huge in conveying what we want to say. You can tell really if someone is upset just by how they're even sitting in a chair sometimes, or again, if they were crying or something like that. It's again non-verbal. So again, different types: letters, books, magazines, charts, maps, logos, objects, and pictures. Think of as there are people and ways to use them. So we talk about this non-verbal, which is hugely important and makes up a really large percentage of all our communication. It's very rare that you will just hear a voice talking. So you have things like eye contact, your facial expressions. Again, they convey how you feel about things, the tone of voice that you're using. If you're angry or upset or happy, the tone of voice changes. If you're asking a question, your voice might go up at the end. Then your body language, how you're sitting, how you're lying, how you're standing, can convey a lot of information. The gestures as well, how you use your hands. Again, even move your head around if you're nodding or shaking your head, that's a form of communication. Pointing, using pictures, or even how we dress or act, and sometimes even our scent. If I was to turn up here for this talk in my pajamas, that would convey a certain message, and that's a form of non-verbal communication as well. So how we dress actually is really important for one of those as well. So there's all different types of the non-verbals to be aware of. And then communication then plays a huge role in our lives, and it enables us to take part in everyday life, to build connections with others, which we as human beings absolutely need. It allows us to share our thoughts, our ideas, our concerns, and it allows us to make really important decisions about our own lives or the lives of people around us if you're taking part in those as well. And it allows us to express who we are as individuals. So it is really, really important. So then we talk about conversations. And I want you all to think for a moment about who are your conversation partners. So who are those people that you talk to? So once you have a couple of people in mind, do you have anyone who's your favorite? Do you really enjoy having a conversation with somebody? And if you do, why? Just have a think about that. Why is that person your favorite? Or do you have someone who might be your least favorite? And again, why is that person your least favorite? just be thinking around with that. So some of them might be your favorites, might share the same sense of humor, you might know them really well, you'll have a really strong connection with them. Or even post-stroke, there might be those ones who actually take the time and support you to communicate your message. Or some of those with that might be your least favorites are ones that you don't really know that well, who are in quite a hurry to get through things and who mightn't support you as well. But you'll all have your own ideas. So it's really important to think about that. And if someone if you prefer communicating with someone or having a conversation with somebody more than someone else, to have a think about why, and if there's anything that you do with that particular person that can be transferred then to other conversations with other people. So we talk about then how to be a good communication partner. And this is really important, especially post-stroke, if you are having difficulty with communication. What I would say is that actually most of these you should do when you're chatting to anyone anyway, irrespective if you have a communication difficulty. So the first thing that should be done is you acknowledge the person. So you greet them, you say hello, and you speak to them. You take a look around at the environment. So you limit the background noise. Again, you might turn off the television, you might turn off the radio, you might close the window if it was quite noisy out, things like that. So you might put your phone on silent if you're having a conversation, or even it might just be that you close the door to limit some of those sounds coming in. Again, then it's really important that you sit face to face with the person so that they can see you and you can see them. Because as we spoke about previously, a lot of our communication is done non-verbally. So you'll be able to pick up on those cues. And also then when face to face, you have those cues from your face and you can look at actually how they are speaking as well. And all of that can help improve a conversation. So it's important then to introduce the conversation topic. Don't just leap into what was wanted to be talked about. You state what it is. It can help direct conversation then. Again, don't speak too fast. It's something that we all love to do some of the time. So make sure that you're not speaking too fast. At the same time, I'd say don't speak too slowly. Like we said previously, there's absolutely nothing wrong with your intelligence after having a stroke. It's just that you need that little bit of extra support with the communication if it applies to you. So speak at an appropriate pace, not too fast, not too slow. Maintain eye contact. It's just good manners as well. So, and then to take turns in conversation. So nobody should monologue or talk constantly themselves the whole time. You need to give somebody else a chance. So that whole thing with a conversation is that it is turn taking. It's two or more people having a discussion. Someone says something, someone responds, it leads the conversation and so forth. So don't take over, give everyone a chance to speak or give everyone a chance to communicate their message, be that pointing, nodding their head, with a gesture, with a picture, with something written. So don't take over, let the other people communicate as well. And to use that nonverbal communication. So to use your eye contact, to smile, to use different gestures with your hands, to point, to use pictures, writing can help, writing down words, whatever it is that you have, maybe picking up objects, miming things, whatever it is, use that nonverbal communication as well. Anything to get the message across and to make sure the message is understood. And this might seem a bit obvious, but make sure you end the conversation as well, is that you've discussed everything it is and that you very clearly have an end point to it as well. And then really, really important is to listen and to actively listen to what everybody is saying. And then give the person time. And I can't stress this enough. If you have a communication difficulty, the most important thing you can do is give time. Allow some time for what you've said to be processed, for that understanding part, and also then time to be able to form a response, be it a verbal response or a non-verbal one. So allow time for that response to be given. Don't interrupt. Let the person talking have their go. Try to get out what they want to say or what they want to communicate. And then very important as well is to adjust your speaking to the right level. If somebody has a communication difficulty, where shorten your sentences. If the person has a dysarthria, like we mentioned, where it's just their speech sounds a bit slurred, There's no need to talk in really short sentences. They can understand, they're fine. So just you're speaking to the right level that matches the person's communication difficulty. Use visual aids where necessary. So if they're needed, use them. And sometimes even if they're not, it's handy to have them. We'll all do that in conversations. We might show something on our phones or a picture in the newspaper. We all use visual aids, so use them if they're there. And then it's really, really important to acknowledge that there will be mistakes and understandings, and that's perfectly okay. And that's a really important thing to set out from the start, that it's not going to go 100% correct the whole time. And that's something that happens in every conversation. Somebody mightn't get it, so it's really important to acknowledge that there might be that misunderstanding, or you mightn't just say exactly what you were hoping to say, and that mistake. And that's okay. You can have another go, or if the message is understood, we can move on. So we talk about something called total communication. And that's where we use all the clues available to us to help support a conversation or to help get our message across. So that might be the things like the environment, like we talked about. So things like turning off the television, closing the door, closing the windows, sitting up, looking at the person. Then really important to respect those pauses. So you're giving them time, or you're giving whoever it is time with that. So if someone has paused, they may be thinking about what they want to say or how they say it, or they may be thinking about what you have said. So to respect those pauses, I would say to everyone is to count to 10 in your head, and you count to 10 in seconds. So 1, 2, 3, at that speed, before you start to say something else. So really respect the pause. You can use touch to draw attention if it's appropriate. Always ask consent as well, to draw the attention in or to redirect. Again, then gesture is really important. Even something simple like a thumbs up or a thumbs down can be really clear ways of communicating, or pointing, things like that. I know I'm terrible for it. I'm being very conscious not to wave my hands around when I'm talking, but we all use gesture when we talk. So it is really important to do that. Use pictures if we have them, and photographs, pictures from magazines, books, ones you find on the internet to convey your messages, ones that might be of common everyday things you use if you're stuck. The tone of voice then, like we mentioned, really important. It can help a lot. If you're frustrated, you can tell by the tone of voice. If you're upset, if you're happy, again, if you're asking a question, that tone of voice changes. And then that body language as well is really, really important. So to sit upright, look at the person, be alert, be actively listening, ready to receive that message. And again, take into account the other person's body language as well. Are they looking a bit confused, frustrated, upset, whatever it might be? So pay attention to that body language as well. And then signs can be really important to use as well. So I don't know if anybody does know any different types of sign language, things like that. But even if you don't, like I mentioned, a thumbs up, a thumbs down, that can be a form of signs there as well. And then drawing or writing. So use everything that's available to you. And that's what we mean by total communication. And again, that's one of the most important things to do. So I suppose in the same way that a wheelchair user may need physical ramps to enable them to access buildings, you'd never expect them to try get up the steps. A person with a communication disability may need communication ramps to enable them to access the communication and conversation. So those ramps are like the things that we spoke about just there. So what we talked about, and this is kind of a basic resource kit that can be really handy to put together for everybody. So things like photographs, a calendar, alphabet boards, so just even scribbling out the alphabet, or number boards, maps, color charts, newspapers, pens, papers, phones or iPads. So anything to support that conversation around that. And it's really important to put together a basic resource kit and figure out what works well for you and your conversation partners in that. Okay, so it's briefly mentioned, and Katie's going to talk a little bit more in detail about some of these. So how to help somebody with receptive, so this is another word you might hear, and what we mean by receptive language is their understanding. So that's why we have that in. So how to help somebody with difficulties with understanding. So it's really important, first of all, to know what everyone's level of understanding is. Is there a difficulty there or not? Because that changes how you're going to communicate your message. Again, like we've mentioned previously, limit the background noise, sit face to face, maintain eye contact, give the person every chance to understand the message. You're using everything available. Speak slowly, use short sentences, emphasize the key words. So what's most important? Really emphasize those words, or just use the keywords. So you're going to use that nonverbal communication, be it your gesture, your facial expression, tactile cues that are there. So be it touching someone to draw their attention or pointing at things that are there. You might use some words, writing down, or pictures to help aid what's needed. And then really important is to check that they have understood. And don't assume that they will, because they mightn't. So check that the person has understood. And that goes both ways, both for the person with the communication difficulty and their partner, is check both people have understood the message. And then again, when you talk about somebody with expressive language, and what we mean by that is the actual talking, so their use of language. And so for people with expressive language difficulties, we might look at asking yes or no questions rather than open-ended. So it can be difficult to put words together or form sentences. So for example, if you ask, rather than asking, what do you want for dinner? You might say, do you want fish and chips? And they can say yes or no, or they can nod their head or give you a thumbs up or a thumbs down. So that's what you mean by asking a yes or no rather than open-ended. So you look out for their nonverbal communication as well. So if somebody is having trouble stringing sentences together, it's really important to take into account the eye contact, the pointing, the gestures, how they're sitting, standing, to take all of that in, because it's going to help to convey their message. And then to be aware of if the person has another means to communicate. So is there a communication book? You might have gotten this in rehab, or is there what we call an AAC device? So this can be something very, very simple, like a pictures on a board that you can flick through and use the pictures, or it can be something more high tech, like an iPad or a laptop that has different software on it to help them. So you might have things that you press buttons and it says words for you. So do they have a different device as well to help with that communication? So if they do, make sure that you're using it in the conversation. And then it's really important then to make sure that all the focus is not on that verbal communication as well, so that you use all modes of conversation. And that is really, really important to ensure the person is kept in part of the conversation. You don't talk over them, you give time, you respect the pauses, and you facilitate their communication and conversation. So really important then. So what we're going to talk about then is what happens if the person has a severe communication difficulty. So there's a couple of things that are really, really important to do in this case. So it mightn't just be a mild one, and some of you may have a severe communication difficulty, and some may have milder ones, like, because everyone's journey is different and everyone's difficulties are different as well. So it's really important to use all your communication skills. So again, I can't say it enough. I know I've said it several times, but they're really, really important. Use everything you have available to you. Use your facial expression, the different tones in your voice, raising it, lowering it, making it happy, sad, gesture, drawing, the speech we have. And it's really important to identify what that person's strength is and to use them to help facilitate that communication. And the other really, really important thing to do with someone with a severe communication difficulty is to establish a reliable way of indicating yes and no. Is it a thumbs up, or is it a thumbs down? Is it a written yes or no? Is it a tick or a cross that you can hold up or point to, that they can, or just even look at? Is it the sound of their voice when they say something, even if the word doesn't make sense? Is there different sounds for yes and no, and they're used consistently? Is it their facial expression? Are they frowning or smiling? Do they nod their head or shake? It's really important. If you can establish a reliable yes or no, you can get a long, long way in communicating with somebody. So it's a really, really important thing to do if somebody has a severe communication difficulty. So I'm going to let Katie talk to you a little bit more about how to communicate A little bit better
I'm
there.
afraid of disconnecting the wires here. It's very precarious. So I'm going to move on and just chat a little bit about repairing communication breakdowns. So as Blán had said, irrespective of someone's communication difficulties or their strengths, everyone experiences communication breakdowns at all times. They just might be a little bit more frequent with someone that's had a stroke. So in those instances, if there is a communication breakdown, be honest. Like what Blán had said, if someone has a communication difficulty, it's no reflection of their intelligence. So be honest with them and acknowledge that you don't understand the message that's been conveyed, because chances are they will know it themselves. Just take a couple of steps back and I suppose recap what you understood up until the point of the breakdown. And it can help, if you need to write or draw the key points that have been communicated successfully up until that point. Stay relaxed and give it time. We all know and all have those experiences when we're very flustered or we're very upset by something, and it makes it a lot more difficult to communicate our message. So by staying relaxed and just giving plenty of time, that can help to repair a breakdown. Find out if it's important. So is it a message of great urgency? It might not always be an important message. So if you check in and find out if it is, great, you might need to keep going with the above steps. But if it's not important, you might need to just park it for a while, let things settle and come back to it. And then sometimes, and same with all of us, sometimes you might need to just agree the conversation has gotten stuck and just to take a break from it and come back to it. And that's not specific to someone after they've had a stroke. Sometimes you need to just park a conversation and move away and come back to it. And that happens to all of us in all aspects of our life. So just, I suppose, to facilitate communication in stroke, and Blán has touched on some of these already. So just a couple of do's and don'ts. So finding out about the person's communication difficulties, finding out what their level of understanding is and how they best express themselves. Do they need any other changes to the environment to successfully communicate their message? Trying to keep the environment quiet, comfortable, distraction-free. That's easier said than done sometimes, so trying to do that to the best of your ability. Obviously, if you're trying to facilitate communication in maybe a doctor's appointment, you don't have as much control over that than you might do in your own home. Gain the person's attention before speaking to them. Facing the person, using eye contact to help their understanding so that they can not only see you communicating the message or talking, but they get a good look at your facial expression and all your non-verbals as well. Listen carefully, speak a little bit slower if needed, but still keeping a natural tone. Giving information in short chunks, stressing the important words and leaving those pauses in between sentences. Giving someone ample time to respond as well. So like Blánid was saying, do that counting in your head if needed. And that's a skill that takes a bit of repeated practice because it's not something that comes natural to us. Taking your turns, conversation is a two-way street. Sometimes after a stroke, so when myself and Blánid, for example, are communicating here or having a chat, we're carrying 50% of the conversational load each. Sometimes after a stroke, if someone has a communication difficulty, their communication partner might have to take on an additional percentage of the communication load. But with that in mind, it's still very important that there's equal kind of back and forth and turn taking in a conversation. Always have a pen and paper handy. A pen and paper is your greatest asset in everything, be it supporting a conversation, keeping track of what's going on, or just writing down some important information if you're supporting someone to attend an appointment, that then the person that has had a stroke can refer back to in their own time if they need to. Communicate using any means possible. So Blánid spoke about this with total communication and with multimodal communication. So with total communication, it's putting equal value on any way that someone communicates. So there's no one better way of communicating. So you're using any means possible, and we all use more than one of them at the same time. I know you can't really see me in my hand here, but my hands are going 90 here under the camera while I'm using words and sentences to present. So using them all and any means necessary. If the person wears a hearing aid or glasses, make sure they are in. So all the previous points aren't worth a lot if someone can't hear or can't see properly. And like what Bláthnaid was saying about the ramps, you know, wheelchair users needing a physical ramp to get in, and someone with a communication difficulty needing a communication ramp to access their conversations. Communication is a basic human right. So without even the basics like a hearing aid or glasses, you're actually depriving someone of a human right, which is quite serious. If someone has, you know, a book or a chart, or something more, high tech, make sure it's accessible to them. So I know we're coming from this talk with a communication focus, but that's not the only challenges that someone might face after a stroke. They might have upper or lower limb weakness. They might have difficulties. They might need a mobility aid. So if someone's hands are occupied with their four-wheel walker, making sure that they have a way to access their communication charts, books, pens, or paper. You might have to give a little bit of assistance, or you might have to do a little bit of MacGyvering to make sure that it's easily accessible to them. And encouraging the person themselves to use it. Sometimes people need a little bit of support and encouragement to use it because it's something new and it's a massive change. So providing that encouragement, and if the chart isn't a runner for someone, encouraging someone to use total communication, so pointing, gesturing, all the bits that we've spoken about already. Clarify what you think the person is trying to tell you. So by repeating and rephrasing it back, the gist of what you think is going on. And I spoke about that at the repairing communication breakdown section. Yes, no questions. If you're caught in a pinch, if something really needs to be answered, you know, with urgency, yes, no questions are usually easier to answer than open-ended questions. And remembering that answer might be a verbal yes or no, or it could be something non-verbal or using a visual aid. Choice questions are usually easier to answer than open-ended questions. So we'll go back to the what do you want for dinner example because it's easier. So instead of what do you want for dinner, it might be, do you want chicken or fish? We all have that experience at a wedding where it's beef or salmon. So that's a choice question example. And then just, I suppose, some things maybe to avoid. So like I was saying, don't pretend to understand what the person is saying if you genuinely don't. It doesn't help anyone. It doesn't help someone to participate in meaningful conversations and meaningful interactions in their life. And in the long term, it doesn't do any good. But the other way around, then, don't assume that the person who has had a stroke or has communication difficulties, don't assume that they understand everything that you are saying either, and seek that clarity as well. Don't finish their sentences or talk for a person. And we all have those experiences, be it doctor's appointments, at a shop counter, those kind of things where there's a sense of time pressure, and it might be just easier if myself as someone's communication partner, talks for the person. Yeah, it might be easier, but it's not meaningful. So don't talk for the person or finish their sentences. And don't exclude someone from a conversation. Include the person in the discussion. And post-stroke, there's a lot of discussions going on about you. So you should be involved in them, even if it takes longer. So now, just to recap, always verify what someone is communicating. Don't assume you've interpreted it correctly. You're listening to the whole picture, not just the words. So like Bláthnaid said earlier this morning, a very small percentage of what we communicate are the actual words coming out of our mouth. It's the whole picture that communicates 100% of the message. And then, look, sometimes things are going to get stuck, things are going to break down. It can help if you've got a sense of humor about it as well, but just check first with the person with the communication difficulty if they want to park it or if they want to keep persevering, because some people might like to keep going. And then I suppose the role of the speech and language therapist, and look, there are, like Katie said at the start, I work in acute services, Blonde works in community. There are a lot of different services where you may encounter a speech and language therapist. But in general, our role across those services are to provide an assessment and a diagnosis. So you may hear us talking about those common terms that we're speaking about at the start. It is a speech and language therapist who will give you that diagnosis. There might be a differential diagnosis. So what that means is we would do some assessments to figure out if it's maybe one diagnosis or the other diagnosis, or maybe there might be more than one at the same time. We provide interventions, that's the therapy bit of our job. And this can be direct, so with the person who's had a stroke themselves, or it might be indirect with their communication partners or making some environmental changes. We provide education. We provide communication groups at times if the service allows it. So that could be a support group, or it could be a group for people with communication difficulties to meet together and practice, their new means of communication. We provide training, so that can be to family, colleagues, schools, workplaces, whoever needs it. We work as part of a multidisciplinary team, so we might work in conjunction with other professionals. You might see like a physiotherapist, an occupational therapist. You might see us jointly or on our own. And if needed, we can refer you onwards to other members of those teams if you have other needs that can't be met by us. And a large part of our role is also in advocacy. So just to touch a little bit on dysphagia. So dysphagia is difficulty with eating, drinking, and swallowing. And it can affect up to half of people post-stroke. After you get the hospital. After the hospital. Yes. So just some signs that you may have dysphagia, or signs that you may have difficulty swallowing. If there's a cough during or after a meal, if you experience changes to your voice during or after a meal, and that can be kind of a wet or a gurgly sounding voice. If you feel food going down the wrong way, and that happens to all of us, but if it is very, very frequent, that might be a sign that there might be a change to your swallow. If your eyes start watering when you're having a meal or having something to drink, finding certain foods difficult to chew, if you're finding there's a bit of incoordination while you're eating, or you're finding it difficult to get the food from here to here, recurrent chest infections, so more than 1 to 2 per year. And I suppose if you are relating to any of these points, or if someone you know might present with some of these, your first port of call is your speech and language therapist if you're known to one, or you can contact your GP or your public health nurse. Okay, and then just some safe swallowing tips. So, which could also be known as good table etiquette. There's nothing very highfalutin about these.
What your parents taught you.
So always sitting upright at a 90-degree angle while having something to eat or drink. Taking your time, small bites or sips. Mealtimes are a very, very social thing, but if your swallow is compromised, or if you're having concerns about your swallow, alternating between, having something to eat, making sure it's swallowed, and then talking. Reducing your distractions, so telly off, window closed, blinds closed if you've any light sensitivity. Making sure everything is gone after a meal, especially in light of after a stroke, people can have a lot of changes to their sensation, be it in the face. So obviously the face is one of the fast symptoms, face tingling and a facial weakness. So making sure that the mouth is clear inside here after a meal. Staying upright for about half an hour after having something to eat and drink, just to make sure that in light of those sensation changes, if there's anything here or in under the gum, that it gives you time to swallow it down before, going for rest or lying down. Trying to avoid using straws or bottles or lidded beakers unless recommended by your speech and language therapist, and always follow the advice given by your speech and language therapist. Then I suppose just to chat through the speech and language therapy journey. So this kind of starts from, so you've come into hospital, you may have met a speech and language therapist in the hospital or in a different offsite rehab facility, and then you're back home. So you may be seen for an assessment in your health centre or in your home. A person may prefer to attend alone, or they might like to bring someone with them. That is up to the person that has been referred to the service. It's completely up to them. And a typical initial speech and language therapy assessment will take anywhere from an hour to an hour and a half, and might follow this format. So the start of it is just having a chat, explaining, I suppose, what to expect, what we're going to talk about on this slide now, explaining the role of speech and language therapy in management of communication and swallowing post-stroke. We do something called a case history form. Sometimes you might get sent one out with your appointment letter to bring in, or sometimes it might be completed in the clinic. And that's just finding out a bit of background information about, if you have any past medical history, your social history, do you work, who do you live with? Just so we get a true sense of who you are as a person and how we might best meet your needs. You might have an oromotor assessment. So that's an assessment that looks at the muscles in the mouth, the tongue, the back of the throat, the face. You might be asked to eat or drink something in the clinic to check for any presence of dysphagia or difficulty swallowing. And if there are, you would be given a swallow care plan, which is just a plan with advice and strategies of consistencies of food and drink that are best recommended for you, or any strategies that you might need to do at meal times. You might have a communication assessment. This might be informal with just having a chat or, looking at a couple of different pictures. Or it might be more formal and a bit more of a robust assessment. And a person's needs vary on what kind of assessment they need. They are both equally valid. Just some people might need a longer assessment. Then I suppose you will get feedback if, like I said before, if you might need to go see a physiotherapist or a dietitian. A chat would be had at that point about referring you onward if required and if you consent to it. And then a future plan is made. And then we're just going to finish up with this. I think it's a nice way to finish off this presentation. So I don't know if you know Roald Dahl's wife, Patricia Neal. She was an actress, and she had a stroke while she was pregnant, and she had aphasia post-stroke, so difficulties with language. And some of Roald Dahl's writing is based on how she communicated, in particular the BFG. So there's a quote from the BFG here. "I is not a very know-all giant myself, but it seems to me that you is an absolutely know-nothing human being. Your brain's full of rotten wool." "You mean cotton wool," Sophie said. "What I mean and what I say is two different things," the BFG announced rather grandly. So you can have a little think about that, and I suppose it's just a nice way to really hammer home what we've been trying to say about looking at the full picture with communication and not just the words that are being said. So I think we are now ready for questions.
Yeah. So thank you very much for listening to us talk for the last 45 minutes. So yeah, if you do have any questions, feel free to ask them.
Thank you so much, Bláthnaid and Katie. That was really interesting and so informative. What we'll do now is we'll stop the recording